An ectopic pregnancy occurs when a fertilized egg implants outside the uterus, most commonly in the fallopian tube. This is a serious condition that requires immediate medical attention. In a normal pregnancy, the fertilized egg travels down the fallopian tube and implants in the uterus. However, in an ectopic pregnancy, the egg implants elsewhere, preventing it from developing properly. The fallopian tube is not designed to support a growing embryo. As the pregnancy progresses, it can cause the tube to rupture, leading to internal bleeding and life-threatening complications. Ectopic pregnancy is relatively uncommon, accounting for about 2% of all pregnancies. However, it is important to be aware of the condition and seek immediate medical help if you suspect you may have it. The exact cause of ectopic pregnancy is often unknown, but several factors can increase a woman's risk. These include previous ectopic pregnancy. If you've had an ectopic pregnancy before, you have a higher chance of experiencing it again. Pelvic inflammatory disease, or PID, which is an infection that can scar the fallopian tubes, making it difficult for the egg to travel to the uterus. Endometriosis, a condition that causes uterine-like tissue to grow outside the uterus, potentially affecting fallopian tube function. And certain fertility treatments, as some assisted reproductive technologies, may slightly increase the risk of ectopic pregnancy. Other risk factors include smoking, age over 35, and having multiple sexual partners. It's important to note that having any of these risk factors does not guarantee an ectopic pregnancy, but it's crucial to be aware of them. Early symptoms of ectopic pregnancy can be similar to those of a normal pregnancy, such as a missed period and breast tenderness. However, as the condition progresses, more specific and alarming symptoms may develop. One of the most common signs is abdominal pain, which can range from a dull ache to sharp stabbing sensations. The pain may be localized to one side of the abdomen or felt throughout the pelvic area. Vaginal bleeding is another warning sign, especially if it occurs outside of your normal menstrual cycle. The bleeding may be light spotting or heavier, resembling a period. Other symptoms include dizziness, nausea, and shoulder pain, which can indicate internal bleeding. If you suspect an ectopic pregnancy, it is crucial to seek immediate medical attention. Early diagnosis and treatment are essential for preventing serious complications. Doctors use various methods to diagnose ectopic pregnancy, including pelvic exams, ultrasound scans, and blood tests. Ultrasound can help visualize the pregnancy's location, while blood tests measure hormone levels, which can indicate an abnormal pregnancy. Treatment for ectopic pregnancy typically involves medication or surgery. Medication can stop the growth of the ectopic tissue, while surgery is often necessary to remove the tissue and repair or remove the affected fallopian tube. The type of treatment recommended will depend on factors such as the location and size of the ectopic pregnancy, the woman's overall health, and her future pregnancy plans. After treatment for an ectopic pregnancy, it is important to follow your doctor's advice and attend all follow-up appointments.